Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. I'm talking to you today from Tempe Town Lake. Tempe is where Arizona State University is located. It's right outside Phoenix, and this is a man-made lake that contains approximately 1 billion gallons of water. It was first formed in 1997, and last year one of the dam elements burst. It's a rubber inflatable section, and 1 billion gallons of water just drained out of it. And recently, they put it all back, and thought it might be good to come out and check it out. People come out, they go kayaking, they go sailing, well, there's no wind today, and it's a very nice recreational spot. There's a man-made beach on both sides, actually, running, walking paths. Anyway, the topic for today is post-dural puncture headaches. It's kind of a mouthful, but let me explain. When patients go to get a myelogram or a lumbar puncture, basically a needle is put through the outer element, the dura mater of the spinal cord, and either dye is injected or fluid is taken out. It's in a lumbar puncture. And when that happens, a hole is left behind. And it's very, very small, obviously. The tip of a needle, it might be a 27, 25 gauge, at the most probably an 18 gauge, which is still a small residual hole. And that hole typically just seals back over. The usual protocol is for patients to lay down for an hour or two after the study, and then they're allowed to get back up and walk again. If a patient has a really bad headache after they get up and start walking or sitting upright, then it can be indicative of a dural headache. What happens is the cerebrospinal fluid starts up in the brain and it goes all the way down the spinal cord. And if there's a hole and it's seeping out, the structures in the brain, the meninges and things like that, they're very sensitive to not having the fluid that they need. And they can get very, what happens is the cerebral vessels dilate and you get a huge headache, which is often alleviated when the patient lays back down. But you can't lay down forever. So if that happens, usually the first course of treatment is for the patient to lay back down and stay there for a certain period of time, maybe a few hours, and to see if that seals it over. Other things that can be tried include hydration, drinking a lot of fluid, maybe getting some of the pressure back, making more cerebrospinal fluid. Of note is that your cerebrospinal fluid in the human body replaces itself every 4 hours. So if a lot is drained out and you lay down, within 4 hours, you've produced enough to replace that. The question is that hole going to be sealed over? Caffeine is good. It can help constrict those blood vessels that have become dilated, and the headache can dissipate. If the headache doesn't go away, and the patient still has that leakage, a very good treatment for it is called an epidural blood patch. And that is when a patient's own blood is taken out from a vein, it's actually re-injected into the epidural space, and it can help seal over that tiny little hole and make the symptoms go away. How it does that? Not really well developed. The theory is that the blood kind of filters through and then finds the area of least resistance, which is where that hole is, and then just seals it over. And that's the end of that. Patients won't need the surgery, and they'll get back to walking around without significant pain. Anyway, that's what a post-dural puncture headache comes from. Tiny little holes from either a myelogram, or it could be from a American needle during an epidural injection. Anything really where you're in the epidural space with a needle, it happens. It's a complication that's well known. This is Dr. David Greene from Preferred Pain Center. Your pain stops here.